The COVID-19 disease is said to be of an animal origin through spillover infection. Spillover is a common thing because more than 2/3 of human viruses are zoonotic. The Huanan Seafood Wholesale Market, the live animal and seafood market in Jiangnan district of Wuhan, in the Hubei province of China, has been reported as the center of origin for the coronavirus pandemic. Sections of media like the Wall Street Journal and Time reported in late 2019 that the market had livestock kept in close proximity to dead animals. New York Times reported about the dismal sanitary conditions and poor ventilation in the area, with narrow lanes and stalls so near that the animal were openly slaughtered, made it a clear breeding ground for germs to thrive. The South China Morning Post reported in March 14, 2020 that a 55-year-old man from Hubei may have been the first person to have contracted the COVID-19 infection as early as November 17, 2019. By March 14, 2020, 67,970 cases have been reported with 3,075 deaths in the Hubei province. By January 2, 2020, a new strain of coronavirus, called SARS-CoV-2, was identified in 41 people who were hospitalized with pneumonia. 2/3 of this set of people were known to have visited or been a part of the Huanan Seafood Wholesale Market. As the link between pneumonia cases and the market was solidified, it was believed that the virus may have been transferred to humans from animals. A study, on February 3, found out that the coronavirus in the bat sold in the market has 96% of genetic material identical with COVID-19. But there are no documented evidences of direct bat-to-human transmission, which means there is a likelihood of an intermediate host between bats and humans. When researchers employed genome sequencing to compare the DNA of the new coronavirus in humans with that in animals, they found a 99% match with pangolins. Pangolins are in demand in China for their meat and their scales. Although sales of the animal are forbidden in China, as part of a worldwide ban, they are still smuggled in from a handful of Southeast Asian and African countries. Yes, the market had a role to play in the COVID pandemic, but we are not sure if the novel coronavirus actually started in the Wuhan market. The first case reported in December 1, 2019, of the person who had symptoms for coronavirus, did not have any exposure to the market. But The Lancet reported that out of the first 99 people who were admitted with COVID-19 in Wuhan Jinindan Hospital, between January 1 and January 20, 2020, 49 had exposure to the market. So, we are still not clear if the market was the origin, or a key link to the pandemic. In late January 2020, the Chinese Center for Disease Control and Prevention revealed that the virus was found in 33 out of 585 samples collected from the market, especially from the wildlife section. On February 24, 2020, the Chinese government announced that the trade and consumption of wild animals is completely banned throughout China. The COVID-19 coronavirus pandemic assumed importance after a set of mysterious pneumonia cases were recorded in Wuhan, China. A hospital brought this to the attention of Disease Control and Prevention, CDC, and health commissions on the 27th of December 2019. The Wuhan CDC on December 31 made it clear that these unknown pneumonia cases were connected to the Huanan seafood market. The potential disease outbreak got the attention of the National Health Commission, NHC, in Beijing, who sent experts to Wuhan on the following day. On January 8, a new coronavirus was established as the cause of the pneumonia. The sequence of the virus was published as an open-access database. The World Health Organization praised China for a swift and transparent response by the Chinese government. However, the damage was done because of delayed response by Wuhan and Hubei authorities to take proper steps to restrict the outbreak of the virus. By January 29, the virus had spread to the mainland China. By February 8, 34,878 people were known to be infected with 724 deaths. Hubei was then the epicenter with 24,953 cases and 699 deaths. The World Health Organization reported that new cases have been cut down in China drastically but began growing in big numbers in Italy, Iran, Spain, South Korea, and United States in February and March. As of the 13th of March 2020, cases by country across Europe doubled over periods of typically 3 to 4 days, with some countries doubling every 2 days. COVID-19 is known to have spread to Italy, first on January 31, 2020 when 2 Chinese tourists in Rome were tested positive for the virus. A week later, an Italian man repatriated back to his country from Wuhan was tested as 3rd case in Italy. Then more cases came into rise, with 16 of them in Lombardy by February 21. By February 22, there was a reporting of the first death in Italy. By March, the entire country was gripped with coronavirus. On January 31, the Italian government suspended all flights to and from China and declared a state of emergency. By March 22, 2020, the country became the most active center in the world for the spread of coronavirus, with 59,138 cases and 651 deaths in one day, taking the toll to 5,476. The average age of those who've died from the virus in Italy is 79.5, with infected median age at 63. As of now, there have been more than 196,000 cases worldwide, across 160 countries and territories, with 7,900 deaths, and 81,000 recoveries. If you found this video helpful, please hit the like button and share it with your friends. Do not forget to subscribe to our channel, Health Destination. Stay tuned for more videos in our series, Let's Beat COVID-19.